Oh,
Does not
Jesus.
make me feel great. No, it
No.
does not.
Wow. Wow. Yeah, I'm searching trademarks, patents. Patents?
Oh,
No,
what,
trademarks.
Lisa,
Word
why are
marks.
you searching trademarks? Why are you doing that? Tell us
Okay,
why.
okay.
Tell us
Okay,
why.
first of all, I'm Lisa, that's Kat. We just
Oh
both
yeah.
filed a complaint. It's rough, you guys.
It's a rough Friday. This is a
This
duly
is the
rough Friday.
worst in terms of how we are feeling collectively. Not great because we had an amazing dinner last night. We'll talk about it. But I think I'm Lisa. I think that's Kat, and I'm searching trademarks because the U.S. government apparently just got some kind of response back from their own patent and trademark office about a service mark registration for TEFCA, Trusted Exchange Framework Account Agreement, QHIN, Qualified Health Information Number. They just got the response back in 2023 at the end of November from their own government. And that's
That does seem, at least everybody's following the same process, right?
wow.
Like,
Wow. Yikes. Yeah,
yeah.
no special treatment is all I can
No
say.
special
Sorry.
treatment. But
Shame
tell
OMC.
us
Okay.
why are you looking that up? It's
Okay.
weird. It's like
What
weird.
happened? What happened?
What
Okay.
happened?
We just got back from Washington, D.C. Some of us had to travel further than others, where we were at the Office of the National Coordinator for Health IT annual meeting, live, in person. First time since 2020, where probably everyone had COVID and we're sharing it around. This time, probably also, but we don't care anymore. That's clearly the summary.
That's the vibe. That's clearly the vibe.
Clearly the vibe. No one cares. And during this meeting, they announced victory. They did that famous George Bush mission accomplished on the what's it called, aircraft carrier.
Yeah.
Wow, it's not
That's what
going to be a
I'm
good show.
talking
On
about.
the aircraft carrier, mission accomplished, and announced that TEFCA is live. And they said that there was actually information being shared. There were actually documents being pushed around the internets from QHIN to QHIN. That is what we were told, and there were people on stage saying that, and that's what happened. And so I was really fascinated to see that they, for the first time, included a trademark, a service mark on those
Weird.
words. I was like, wait a minute, what happened? So maybe someone forgot to trademark the terms? What do you think, Kat?
I think maybe someone forgot to trademark the terms, and then I think
they might.
someone else trademarked the terms in a similar way. I think
This does happen.
there was a similar kind of situation going on. Like maybe there's
Yeah.
an America's QHIN, maybe there's a US
US.
QHIN, maybe there. Anyway, I'm here for it. Listen,
Yeah.
that is the kind of drama that like, yes, yes, yes. But I'm excited that the federal government decided to take accountability for trademarking its own weird acronyms. Like, absolutely here for it. So that's great. But yeah, we had a good time. We're a little tired. Lisa just flew across the
We're struggling.
country. I mean, I just flew down a couple states, but that's fine. We got the best of New Jersey on here. Let's bring her on and ask her. Melissa's also a little tired. Everybody's a little tired today. So Melissa, how was the ONC meeting? Like, was it even cool?
I mean, yeah, it was cool,
That's his voice. We might have to take her off.
Sorry, guys, I'm a little bit stressed out over here, but no, it was pretty interesting. Mickey was talking about the rule that dropped, and TEFCAs are real now, so it was pretty interesting.
TEFCAs are
real.
We're having kind of worse sound than normal. Actually, I know has an echo going on here, but we've got our production values have dropped from their already low level to an even lower level, reflecting our level of awareness and consciousness today.
Oh no! Oh, I mean, yeah, probably.
I think it's me.
It might be me.
So basically, like what happened at this event. So they're at the actual ONC annual meeting. So first things first, on the 12th, we were invited to the QHIN coronation ceremony at HHS. where they
It was real.
ceremonially signed the common agreement. That's the common agreement part of the trusted exchange framework and common agreement. They stood on stage, they did a signature, and they shook hands with Secretary Becerra, and they walked off the stage. There was no music. It was very boring. Sorry, everyone. And then we went to a celebratory brunch afterwards. It was a somewhat exclusive event. And
It was somewhat exclusive.
and then there was a day, like a random day in the middle, and then the ONC annual meeting started. And so that's what happened. So it's actually happening right now. Like it's ending as we speak.
Oh yeah, it's still going on.
Traveler. Yeah, I'm not a time traveler. I realize we have a question Melissa put in the chat here from Kevin. How am I at home already? Yes, those Eagles do move. Specifically United. I will also say my flight home on United, there were not one but two luminaries of our political system on the flight. First, Janet Yellen on the flight, and then I turned around and Nancy Pelosi was also there. So
really, shit, God bless America.
San Francisco, like a real, like lots of stuff was happening. Hoping there were some fighter jets alongside us. I don't know how that works, but I'm just guessing they were there.
I think that's probably how it works.
That's probably how it works.
Yeah, that is probably how it works. Well, that's fantastic. I'm excited for that. Yeah. So, the Kyohin coronation, it was all right. You know, there wasn't quite as much drama as I hoped. We did learn about Sam Roots was right. There is a secret Kyohin applicant. It's eClinicalWorks, which everyone kind of knew because someone leaked the guest list and eClinicalWorks was like all dripping all over it. So, we figured that was a thing. So that's exciting. Surescripts everybody knew about. There was one that I thought applied that they kept not mentioning, which was like kind of weird, but I assumed some of that has to do with
there. There's some intrigue there.
Yeah.
We just don't know yet. We'll figure it out.
Yeah, we just don't know what's going on. We're gonna find out. But I wish I could tell you guys I went to more than half of a session at the ONC meeting, but I had some solid lobby time as per usual. It was super great. Saw some good people, had some good business going on, threw an interesting person party. Lisa was my unofficial co-host. It was great. We learned some random things. We learned that one of the Kyohin CEOs, John Blair, is a cowboy.
He was a rodeo cowboy. Rodeo cowboy, John Blair, Dr. John Blair. I don't know the whole backstory, but they wrote about it on their site. So, I don't know. I mean,
he must be proud of it. Is all I have to say about that. Yeah. We also learned there's a new role at ONC.
Yes. And we might have started the rumor. Do
you think we did? No, Lisa, no one sent this one to Politico yet, so it's not your. I mean, we're going a little slow today, so maybe next week. But what was that rumor? What's the new position that I heard they're creating?
Okay, so we heard they're creating a new role of Chief Patient Officer at, let's just call it HHS. And it turns out as well that someone we know pretty well, Grace, is in the running for that Chief Patient Officer role. You heard it here first.
Yeah, you heard it here first.
If it's a good idea, you should definitely write about it, post about it, express your support. I would support it for sure. So Chief Patient Officer, Grace.
Yeah, I mean, here's the thing about that. First of all, it's a great idea. So I'm glad whoever decided to make that an idea that's real, definitely real, brought that up. Totally. And I mean, the other thing is, so it's Grace Polanski Cordovano, right? She's and she speaks fluent Polish in case anyone cares. She spends a ton of time campaigning for patients, and she's done a lot of, from what I understand, kind of free work with our federal government. Apparently they
a lot of free work. A
lot of free work. Yeah, she's been doing it all the time, zipping around the country, informing people about what patients need, which, is a critical thing for us. And I heard they're finally acknowledging that maybe they need her for real. And so Chief Patient Officer, that's what I hear. I don't know. She's probably going to make $100 million doing that job, but I think it's a great idea.
I'm not sure patient advocacy has always been the most well-compensated role in the world, but in the government, they're going to pay her for sure at least what a GS-15 makes. So that's something. And additionally, she's going to keep doing her patient advocacy work on the side where she goes and helps people who have serious illnesses, rare diseases, complex conditions. And she's out there advocating for them, talking to the hospitals, talking to the doctors, getting their records, carrying their records around for them, finding them, getting a printer, probably a fax machine, everything you need to do patient advocacy work. You got like a fax machine in your backpack, basically. But that's what she does,
Yeah.
and she's amazing. And she also does all this work for free for the federal government, who really need that role of chief patient officer. So I would say it's great they are finally recognizing her, and I'm excited to welcome into her new role of chief patient officer, which is definitely real. We did not just
Absolutely
make that up.
real.
We
We
are
did
willed
not
into
make that up.
existence.
That's
This is
real.
called manifesting. This is manifesting, everyone.
We
We're manifesting.
sometimes make up rumors. We do, like the
It works,
initial
though.
thing. Apparently, that's
It
not
works.
true. That's what I heard. I don't know, but this one I think might be real. Like I think it's happening. I've heard about it from several people, not just me and you. So I think it's good. I think it's good. Yeah, Grace also does a lot of her actual patient work pro bono. So
Totally.
y'all. The other thing is like pay
It's
people
time.
money. Like pay people money if they do stuff for you. Like pay them. So
Yeah.
pay people
I like
money,
it.
especially if they're
I'm
providing a
into
ton
it.
of value. Absolutely. Okay, what else do we have going on? Are we going to go into hope that our special guests carry us through this hangover episode?
Yeah, I mean, this is definitely one of those. I would just say, in terms of like actual news, so ONC promised, or I think Secretary Becerra promised on the 12th that there would not be a like night before Christmas like drop of a new rule. But then they like immediately dropped the
did.
final HGI-1 rule, like really just a little poke there. It is the final rule, so like there's no comments. You just kind of have to read it and understand it. It seems like we know they were lobbied pretty hard about the exception to information blocking component of it that was related to TEFCA. Basically, they more or less proposed that if somebody says they're signed into TEFCA, then information blocking is null and void, which is kind of dumb. No offense, guys. I wrote in the comment letter because it's the whole point was that you're supposed to be unlocking information, not letting people have like weird safe harbors and just say, "Oh, we tried. Sorry, LOL, forget it." So they brought that they rolled it back a little bit. They said both parties have to be connected to TEFCA. They limited what you can do. They limited the safe harbor. So hopefully there will still be some actual enforcement around information blocking. The whole goal was like to move health information, not let parties just hold on to it and not share it if they don't want to. So we'll see how that plays out. There's already been some criticism about this final rule in terms of that, just wanting to get it taken out completely. And then also, this just making all of these data standards like USCDI version 3 like optional. So again, it's just sort of like how you are the more advanced version of data element standards for healthcare, and kind of just saying like, okay, we're going to make it easy. You don't have to move to the new version anytime soon, and that's kind of a bummer. So stuff like that. We'll link to it. We'll link to the summary. You can read it yourself.
We'll link to some good summaries. Yeah, no, that exception does bum me out. Like as someone who like brokers massive data deals, right? Like, I'm not doing like the onesie twosie bullshit, like whatever. That's for pretenders. But like, I'm talking like million member panels and shit is what I deal with. And the information blocking rule is useful there. Like it really is. It's opened up a lot of opportunities, a lot of organizations that previously wouldn't have shared. And again, I've said this before, even before enforcement came on the vendor side and on the HIE side. I mean, the HIE side they still got a little bit of trouble there, but so it really bums me out that there would be anything that rule would be sacrificed. That it would be watered down at all, because I think
it was the coolest rule. It was the best rule. It was like
the information blocking rule is my favorite rule. No, but to water it down for TEFCA, and I think a lot of people think like, oh, whatever, it's the information blocking rule. Like I think because also no one sees how much data is actually flowing because of it. It was like, oh, whatever, like, because this is like back end shit that's going on, right? And so it really bums me out. So I'm hoping that everybody continues to share, because for them to say like, oh no, we're in TEFCA, like that's just like bogus. It is not what we need right now for like mass data flow. So anyway,
we have another rumor though. I want to just talk really briefly about the rumor that we heard. Well, so we were at the conference and kicked off, and a couple of people spoke. Deputy Secretary Palm, and then Mickey Tripathi, the national coordinator, and it sounded to me like he was giving a like thank you, congratulations, we did it, and now I'm leaving speech. Now, Mickey is wonderful. We had dinner with him last night and saw him throughout the day.
He's a good guy.
Great national coordinator, really, knows everyone, talks to everyone, super available, like great national coordinator. But it sounded like a goodbye speech to me. I mean, he did not tell that to me, just to be totally clear, but it sounded to me like a goodbye speech. So I'm thinking, all right, so let's say he goes, what do they do? Does somebody else come in? Are there potentially, things happening behind the scenes right now? Who knows? Who knows?
Who knows? Who knows? I mean, he wasn't like, "Hey, Kat, I'm out." I did tell him that,
He did not say that.
I guess because he's like our chief regulator, he didn't think that he had to like RSVP in an appropriate process to
showed
our
up.
dinner. So I was
Showed
real
up.
freaking pissed. Yeah, I mean, like he kind of said, like, listen, I was managing that RSVP list like a freaking hawk, like an eagle. So I
Like
did
an
tell
eagle.
him, I said, "Hey, listen, when I'm national coordinator and you invite me to a dinner, I'm not just gonna like tell everyone I'm coming and not ours. Like I'm gonna RSVP in a timely fashion. And I'm gonna show up
That's
on time.
right.
That's what's gonna
That's
happen."
right.
So, but yeah,
Maybe
but
you should be, maybe you should be national coordinator. What do
oh
you
yeah,
think?
I'd be great at that job. I'd be freaking great at it. Can you imagine me working with rules and like
No,
guardrails and
no, I
like
cannot.
no, it's not gonna work out. But you know what, Lisa, if you're the national coordinator, I will strongly support you. I recognize you may not be able to be in the talk show anymore, but
Thank you.
that's okay.
Thank you.
That's okay.
We'll
That's
see.
I mean, hopefully you'll give us some transition time before you take that very important.
That is not the
meaningful
rumor that
role.
we're starting, just to be totally clear.
That Lisa's
That is
the
not
national
rumor.
coordinator?
That's not the rumor. The rumor is that our good friend Mickey may have been giving a goodbye speech. I don't know. We'll see. Time will tell.
I mean, the other thing is like he's just like kind of good at speeches, so he's got the big feels. Like he's got good
He's a
charisma. I mean, it wasn't
Yeah.
as good as my speech last night. Let's be clear.
No,
But yeah. So it could have just been like we were all emotionally moved, and normally people aren't that
Totally.
good, so it could have been that too. But if he is leaving, I do hope that we have a cool and diverse and unique set of potential.
A new perspective, let's call it.
A new
brand new
perspective. Yeah. I hope we have a brand new perspective out there. But, eventually, I mean, here's the deal. Eventually, he will have to leave, right? Like, eventually. So one day, this is like me believing in the long, cold winter.
True.
Eventually, I'm going to be right. Like, eventually, we will have bad markets.
Someday it will come, but not this day because inflation and hiring, it's going great. The stock market rallying. I am so sorry, Kat. The last week did not serve you well. Major rally in the stock market.
Yeah, well, sometimes things are really good until they're really bad, Lisa. That's all I have to say about that. I don't know.
Yeah.
Like things are good and then they're not. Everything was fine until it wasn't. All right, let's bring in some real energy over here. All right, first special guest, Nikhil. Oh my God, we met this guy.
How's it going?
This guy is famous.
Yeah,
They're like real. Oh my God.
We like sent him an email. He responded.
As niche as fame gets is where I sit. But yeah, thank you for having me. I'm excited.
Absolutely. So tell us about yourself. We know, maybe the audience doesn't know. What do you do in the basement that what did you say, basement you're sitting in?
Yeah, is it a garage or
I'm in the
basement?
cave. I'm in the cave. You got to like remove all the lights from where I work because otherwise I get too distracted. Shiny objects make me go in wrong directions. I write a newsletter. It's called Out of Pocket. I'm trying to better explain how the business of healthcare works generally. So write a newsletter, teach some courses, blah blah blah. So yes, generally very online, chronically, if you will, and trying to help people explain how this industry works. So
okay, but how did this happen? Like, so were you in a cave?
I was in a cave,
thought, I'm going to write the most amazing newsletter that anyone has ever seen.
Yeah, it's like that scene with Tony Stark when he's in the cave and he's building the first suit. That's me. Like I'm going to use a newsletter to get out of here. No, I was at a company called CB Insights for about 4.5 years doing healthcare research stuff. Then I was like, oh, I should learn how to build a company, and then went to a healthcare company called TrialSpark that does clinical trial stuff. And then after 1 year, I was like, oh, I'm actually not good at that. So then let me go back to doing the research stuff. And here we are, about 3.5, nearly 4 years later, still chugging along. I'm still surviving. So
surviving. Are you in the winter or are you on the beach? How are you feeling about the economy? I just curious.
I am in the winter, hoping that the beach comes soon. No, I think
There
it's
we
good.
go.
I mean,
Hopeful. It's good to be
it,
hopeful.
totally. I actually think, for what it's worth, it's like a little correction has been good for just like most companies to figure out, like, oh yeah, like if we did want to get to profitability, what would we have to do? If we did want to, figure out how to like be more, make our resources extend for longer periods, like how would we do it? It's like a very serious gut check. And I don't know, now next year, my like, my unfortunately in finance friends tell me that they expect things to pick back up. So yeah, I don't know. Everyone is like, I don't know if you guys follow prediction markets at all, but a lot of
Not
them
like you.
have.
Not like you.
I
Tell
I'm
us
on the
more.
edge. I'm on like the weird edges of the internet. But the prediction markets have been pretty good at actually predicting interest rate
Right.
changes over time, and they seem to be tilting towards interest rate
Wow.
cuts. I mean, if did you say Janet Yellen was on your plane? I mean, that's like
She was.
that's
She's coming. She's in SF
a
right
bullish
now,
sign.
guys. Come on. It's amazing.
That's a
Yeah.
bullish sign. Depends which part of the plane she was boarding, I guess. That is going to tell you which
So
which you expect
I
it.
do not. I couldn't tell, but I don't like. I don't think they normally fly like business or first. Like even though
I don't think they can. I
even
don't
though
think they can.
even though I feel like it's kind like I understand both sides of it. Like I get it, but also like I kind of want her to work while she's on the plane, right? Like so like it is kind of hard when you're like elbowing, here and there. So I get it. Like I can see both sides, but they don't normally fly business class, and I was in business class, so it's fine. We didn't sit next to each other,
Flex
and that
on them.
Yeah.
I mean, I personally paid for it. Just to be clear, I also worked for a nonprofit. I paid for it.
I know.
Upgrade.
I fly
She
first
probably
class
isn't
all the
allowed-
time.
She probably isn't
Mm.
allowed to pay for it. Honestly, is really like what it is. I don't think she's even allowed to do a paid upgrade like with her own money. So tragic.
That's dumb. This is another reason I couldn't be the national coordinator. Can you believe that? That's bullshit.
Travel rules would kill you. They really bad.
One of my favorite things about ever flying to DC is just like the extremely starkly different ads that you see in the Dulles airport, because they're all
Oh yeah.
related to some piece of legislation I've like never heard about, or it's like a Raytheon. It's like a Raytheon ad for like the one buyer that's like purchasing like $300 million worth of missiles
Totally.
in a contract, and I'm like, that is just not. I'm used to like the HSBC ads. It's like, go on vacation, what you dreamed of. It's just so different and jarring to go to Dulles. I'm like, what is this?
Yeah. Oh, you go to Dulles? Nope.
You are not the target audience. I would say it's worse than like national at DCA at Reagan National, because there are that where like if you just stand there in the airport, like you will see like all the senators, all the members of Congress, like whatever. Like they walk. This is the second time I've been on a plane with Nancy Pelosi. Interestingly enough, like
Oh my
literally
God.
just flying back and forth from DC to SFO. It's great.
Such a celebrity.
My travel companion. Wow.
The real
There you
question is
go.
what lounge. The real question is what lounge do they go to? Because that's where you really
Yeah.
want to be posted up.
Yeah.
You know?
That's got to be like a secret, like special people lounge. There's got to be one of those. I mean, they also like pre-board. I mean, their like security staff like walks them up to the like thing, and like, put them on the plane,
Oh, yeah.
stand around.
You know, I don't really know any senators or any, like, I don't know any of those people. Like, I don't know if I would be able to like recognize them. But the LaGuardia airport, I know it's shitty. Like, I don't know what they look
Wow.
like.
Wow.
I just read about them in Politico. I don't see a lot of their faces, but the LaGuardia Sky Club, you see a lot of famous people in that Sky Club, and like they're just kind of like hanging out, like getting their free wine. I feel good about it. Like I feel good about it.
Nice.
All right. So anyway, enough about airplanes and Janet Yellen and all that. So Nikhil, so you started this newsletter. Now it's like a brand. Like you've got like properties, right?
deal.
You've got a conference. Like we saw it all over the internet. You've got like 100,000 million followers. Like just like tell us.
Yeah.
Like we love it. We love entrepreneurs. You are an entrepreneur. We love people who do stuff. Like just tell us about like the journey. Like what are you doing?
Yeah, trying to shitpost my way to glory.
Listen, yes.
So I'm trying. Well, it's funny, I left my job in February 15th of 2020. So that's either like the best or the worst time, right? Depending on in retrospect.
Perfect.
But I was kind of just like writing the newsletter, mostly because again, like I was thinking about what job I wanted next. I was trying to like take some time off and go down some rabbit holes in healthcare. So I just started writing the newsletter because I just find that like writing stuff is like a forcing function for me to learn about things. And then COVID happened, right? And again, like in hindsight, it ended up being somewhat opportunistic because everyone was stuck at home, so they were reading stuff a lot more. They were signing up for
Mm,
newsletters.
mm,
Healthcare was like a hot topic. A lot of new people are suddenly interested in it, and there just weren't
mm,
that many places to get started, especially if you're new in healthcare, right? And so,
right.
kind of was just writing and putting thoughts down on paper and going down like the weird rabbit holes that I was interested in. And yeah, it sort of like took off kind of like on its own, sort of. And again, the bar is really low, right? I'm trying to like make healthcare funny and entertaining, and it's like I don't know, most people in
The
healthcare are
bar
not
is low.
as
We're here. We're here. So
you
yeah.
We're at
you
the
guys
bar.
are you all are at least funny and entertaining. I'm sure the average person you talk to in healthcare is like very milk toast, right?
Boring.
That's what I'm
So
talking about. The bar is
they're just
low.
boring. Their bar is low. So the newsletter sort of took off on its own, and then from there, once you like build sort of distribution, you can kind of test out and prototype a lot of things much faster because you're like, oh, cool, like can I get at least like 10 people to sign up for this thing? Probably, right? And it just like lets you just like iterate and prototype much more quickly. And so someone was like, "Hey, you should do hey, is there like a 101 crash course, that I can just like take?" And I was like, I could do it probably, and then came up with that. Same thing with the conference. People were, a lot of people wanted to try and understand like how other people were doing XYZ operations flow within their startup, and there really wasn't a good place to do it. So it's kind of just been going through a bunch of like ideas where I was like, listen, in that 1 year that I tried to go build something, what were all the things that I wish I had? And then just kind of go like bang a bunch of them out and see if it resonates with people. And that's kind of the whole thing. It's just experimenting a lot, really. It's been fun. I've had a
Seems like
good
it's
time. I get
working.
to really meet really smart people, and that's really like the most fun part of it, right?
Yeah, I mean, I think also just like I like what really is compelling to me is this idea of trying to make some of these topics which are a bit obscure or that have a lot of coded or like in language available to other people, like explaining what it is. Because of course, like one of the ways to keep people out and like is to use a lot of stupid acronyms, like use language
Mm-hmm.
that isn't clear, like be very indirect about how you describe these topics. And if you actually expose them, then first of all, you can say, wow, that's really dumb. And that seems like a bad idea. Or,
Yeah.
wow, you're probably hurting people, or whatever it is. Like, even just by exposing that and getting into like closer to plain language or colloquial language, you really, can
Yeah.
bring, like, shed some light on it, I guess.
Yeah, one thing that's been interesting is that like I think I've just noticed, especially spending time both with people who are experts in healthcare and have been in the field for a really long time, and then total newbies has been actually very nice because what you realize is like a lot of the experts are so kind of like far down the path of like
Mm.
of like knowing stuff in healthcare, they forget what it's like to be totally new
The
and be like,
basics.
hey,
Yeah,
listen, like people don't even know, like you're talking about TEFCA, people don't even know what like a health
true.
information exchange is first, right? Like there's
All
some,
right.
if you're totally new, you gotta like, there's so many like more contextual pieces, right? And the further you are from like being a newbie, the like harder it is to like put yourself in the mind of that. So it's been cool being in the center. And then the other thing too, which is sort of funny, is like, I think this is like sort of like a bell curve a little bit, which is like, when you're totally new, you start asking like really, really rudimentary questions about how things work that
Yeah.
can actually be so basic that it forces you to like re-ask yourself, even if you're like an expert, and
Mm-hmm.
like, wait, why do we do it that way? And then if you to try and answer them, you actually have to go through the process of being like, well, why is it that way? So like just to give you an example, like someone asked me the other day about some stuff in HIPAA, for example, right? HIPAA is like a very old rule, right?
Old
Yeah.
And
timey.
suddenly super old timing. It's been amended over the years and all this kind
Yeah.
of stuff. And then they ask a question about this, and you like go back and you're like, wait a minute, why do we do it like this? And then you're like, maybe today, actually, like in a world where our data is in like a million different places, this thing doesn't matter. Or like maybe the standards, like, HIPAA obviously has a lot of stuff which is just trying to standardize things. Forget even the privacy stuff, right? It's just trying to like standardize data sets and processes and all this kind of stuff. And it's like, well, actually, like maybe that process isn't the right way to do it anymore, right? And it's nice. It's actually been cool. I think the nice part about being like the place where people onboard into healthcare, I guess, is that you have a lot of people who come in that are like asking these first time questions, which seem, on the surface like maybe really basic, but actually can force a lot of introspection. I'm like, yeah, why is this
Yeah.
way? Maybe there's actually a better way to do it today.
I love that.
Yeah, but also you can it's also that then you the overlay on that is also the mechanisms of government and regulation and
Sure.
and lawmaking in general, and a lot of that has changed over the years. But also at any point in time, like within some realm of like what their statutory or legal authority is, an agency can like reinterpret a law, right? They can do
Totally.
new rulemaking. They can say like, well, the law was this, and we're going to basically write a new regulation to kind of like reframe that. And there's all kinds of limitations and asterisks and caveats and all that kind of stuff. But like they also have in the U.S. government, like the way things have moved, like there's a huge amount of regulatory authority at these agency levels, and that's a lot. Like most people didn't cover like the intricacies of the Administrative Procedures Act in their like civics class in like 11th grade
Sure.
or whatever. Like that wasn't like a big, like a big part of the conversation. I did, just I want to note for the record, did get kicked out of civics class. I was disruptive, according to my teacher at the time. I actually had to serve detention.
Ironic.
Which
Weird.
is not no. There's nobody surprised who knows me, but like I did actually like literally serve detention for disrupting civics class. But that aside, like we didn't cover the APA. Wasn't part of it.
True. I do think like the pullback and like looking at like what the problem is so important. And I do appreciate the shit posting and like the simplification. We try to do that, right? We like bullshit a lot, and then Lisa says smart things, and it's hard for everybody, including me. But I had lunch with this guy I really like, John Elwell. He's a CEO of Know2, and he's like a free market thinker. I'm into this guy. And he was talking to me about, and I feel like this is how like really like hardcore, long-timey policy and tech people get, is like they're so like they know the process so well, even though it's bullshit, right? And it's like you do this and then you do that, and then you go on the third floor and you press the light switch and the toilet flushes in the basement, and I know how to do that. And it's also like job security. It's like Lisa said, I think you keep people out, right? Because you've memorized this like ridiculous way to do like something dumb. And then I think when you get someone new, they're like, why don't we just make the light switch do the lights and like fix the flusher on the toilet, right? Like, I think it's really cool. So, well, tell us about the conferences, because it looked like, based on the internet, which we all know is real, that it was a phenomenal success.
Yeah, it's been so for context for people listening, we basically for the second year in a row have run this operations focused conference, and the idea is that we kept it really small, so there's only 80 people that come to it. We have to apply to get in, so we like kind of pick kind of a handful of people that apply, and it's all focused on breakouts. So we have no panels, and the other thing is also we don't tell people who is at the conference until they like actually get in, because I think for a lot of conferences they're like, hey, I'm coming because like the speakers look really good, and the speakers never really like say anything super interesting. So kind of trying to like turn the sort of process upside down a little bit and say like, listen, you're going to come here because the content's going to be really interesting, but we're not going to tell you who is going to be doing it until like you're kind of like committed into it. And so there's like a self-selecting group of people, I would say, that choose to come to a conference like this, which is people who are like very interested in just nerding out about the like ops of stuff. So the conference was great. I mean, I'm like learning a lot about what it's like to run a conference. Also, as you can imagine, it's like a logistics nightmare. But also on top of that, there's a lot of like interesting things around the economics of conferences too, right? Like for people who want to sponsor conferences, for example, they care a lot about just like pure eyeballs. And in a lot of cases, when you're trying to be like, hey, listen, like we have like a much smaller group, but it's exactly the like target audience that you're looking for, that actually like requires a partner who wants to sponsor, who can like see that vision a little bit, because traditional marketing people are like very, very tied to very specific KPIs around like eyeballs to conversion, to like tracking people through an attribution channel and all this kind of stuff, right? Like
Right.
that it's hard for them to envision what we're trying to do. And so anyway, long story short, I think it went really well. We had a ton of different breakouts, from everything like common billing mistakes that companies make to one person did a scenario where you basically are getting sued for discrimination, and you're trying to like role play through this scenario and figure out like how do you approach a case like this, that kind of stuff. So very tactical, practical stuff that I think a lot of people in the operations role have done. And for a lot of people who I think attend the conference, for them, it's like a chance to, I would say, like benchmark how the craziness of their company, and if it's like normal craziness, or if it's like, this is like kind of weird. Like, I don't think you should do that. Like putting a lot of ops people in a room, they there's like a certain camaraderie, I think, that comes out of that, which is nice to see, honestly.
That's awesome.
And this is just to give a little bit more clarity. Like this is what we are now starting to brand like care ops, care operations, and health tech and healthcare companies, or just general.
Yeah. Honestly, it was general ops. So we had people there was obviously a lot of people from care delivery companies for sure, but even everything from like these infrastructure companies that are doing things like credentialing, or companies that are doing like diagnostics, for example. Like there's a certain layer in every company of that the operations are sort of happening no matter what, right? Like employment disputes, right?
Sure.
That's like a thing that any company has to deal with, or even just like dealing with like even like thinking about like, oh, we have to interface with clinicians. Like one of them was how do you manage clinical teams, for example, right? Of course, care delivery companies care about this, but if you're selling to care delivery companies, you also care about this, right? Because suddenly you're like, oh, these are a lot of people that use our tools. So, stuff like that. But yeah, definitely a lot of care delivery companies for sure.
So what do you think? Given all this stuff, and like, you've got this interesting background, CB Insights researcher stuff. You already told us, like, you think the market's going to be good from a category perspective in the health tech industry. Like, where do you think, like, what's going to be the coolest thing and the dumbest thing of 2024?
Oh, interesting. I think the dumbest thing is definitely going to be people using AI to just like automate like really, really, really basic back office stuff. Obviously it's going to be like very impactful, but there's so many. I mean, I get pitches all the time for companies that are just like, hey, we will, like do a robocall for a prior authorization, and it's like, I don't know if that's like really helping, to be totally honest. Right. So what I will think it will do is it'll basically force everyone to acknowledge how dumb a lot of these processes are when they effectively get like DDoSed by AI, right? Where it's like someone's doing like a million spam calls to like for the prior auth thing, right? So I think that stuff's gonna be really dumb, but it's probably gonna happen. I think some of the really cool stuff though is going to be on the diagnostic side. Like I think diagnostics is really going through like a really interesting renaissance right now, I would say, for a lot of different reasons, but definitely like a lot of software enabled diagnostic stuff is like, kind of hitting the FDA and doing some pretty interesting things. And also like a combination of software and stuff like blood-based biomarkers, right? Like those two things start intersecting and you're like, oh, well, we've been talking about cancer screening for a long time, but there are other types of screening you can do using blood-based biopsies and all that kind of stuff. So, I mean, I don't know. I'm like, this is going to sound very jaded to me, but I've become like a little bit red pilled on like the pharma med device stuff, doing like a lot of the heavy lifting in the U.S. healthcare system, especially after like GLP-1 drugs came out, and you look at each of these studies and you're like, oh my god, these are like every single paper that comes out about that, you're just like, wow, these drugs do even more than we originally thought. And also more than that, I think they just fit into the like framework of like the current U.S. healthcare reimbursement system really easily, right? Like pharma creates blockbuster drugs, they get paid very handsomely for it, and there's not that much changing that has to happen for that to happen. Diagnostics, I think, is changing a little bit. Diagnostics have historically been kind of a little bit of like a money pit because they just don't like accrue a lot of the value that they create, I think, where it's like you screen something really early, it's not like they're getting paid from doing like extra good on catching something later, right?
That's like because of the structure of the health insurance system in the U.S., which is best described as like chaotic, like disconnected, right? So if you if you had the ability to like realize the value in one-ish payment system that might be different. But because we have a chaotic, disconnected, like short-term insurance system, we can't, right? That's a feature of the current system, I would say.
Yeah.
I just realized I was like, why can't I see? I was like not wearing my glasses this entire time. Cool.
This is the problem when you party
I've
too
been
hard.
there.
It's like you forget your glasses. You know what I'm talking
I've been
about?
there. I've been there.
Genius.
Yeah.
I wear clear glasses, so every time I wake up, I'm like Velma from Scooby Doo, trying to like find out where I put them on the bedside. You know, like
That's
touching
awesome.
but yeah,
Yeah.
I think diagnostics also the other thing too has been interesting is that pharma has gotten much more interested on the diagnostic stuff because by increasing the screening of a general population, you're more likely to obviously find more people that might be good fit for a drug or a trial or whatever. And so I think you see a lot of this like pharma interest in diagnostic stuff that makes things super interesting. So those are like the two. I don't know. Those are like some of the stuff I'm looking at next year, but I'm sure you'll see a lot of like care delivery models. You see a lot of like that kind of stuff. But like at the end of the day, I think the places software gets best applied is going to be a lot of life sciences and med device stuff, honestly.
Yeah. Well, I'm sad you didn't say that we're going to have all this amazing community health worker, public health stuff, but you're probably right on that. So that's cool. It's fine. It's cool.
Well, no,
I believe you. I believe you.
I don't think that's unrelated though, right? For if you scale down a diagnostic thanks to software, the number of people who can use it suddenly expands, right? You see a lot of
That's true.
caregivers or EMTs or whatever who can do like diabetic retinopathy scans now in a patient's home with an iPhone and a camera, right? Like,
I like
that's
how we tied
really
this back.
thanks to like
Yes.
I'm telling you, it all comes full circle. But that's really exciting, I think. So
I love it.
we'll see.
I love it. I love it. All right, we got time for one more hot take.
Oh, just in general? Oh man.
Yeah,
It's
just
like
like what are
putting me
you
on the
thinking
spot.
about? Like, how's
What's
New
gonna
York
happen
City?
next? Best prediction, whatever it is.
Yeah, whatever. Because we never
Hot
know what's going
tip.
to happen. We never know what's going to happen.
Yeah.
Well, I'm curious what you guys think of this because someone told this to me and I kind of generally agree, but I think you two are both more experts on this than me. Someone was basically saying we have this we are like over caring about the data standards in which data is basically like coming out.
Oh, I fucking agree with that.
And
Yeah.
their take, which was interesting, and I kind of agree, is that a lot of these large language models, AI, all this kind of stuff, basically can take any unstructured data form and turn it into something really interesting. And so the question is just like, if we just dump everything into like a data lake, essentially, and then we put more emphasis on the retrieval aspect for like whatever end use case, doesn't even matter like what standards we're using for what, as long as like the data is accessible in some capacity. You know what I mean?
Out here in the great free private sector, I strongly agree with your sentiment.
That's sort of my
Lisa doesn't. Well, Lisa maybe does.
I do not disagree. I think that is definitely like a dream of, one of the ways that you could apply AI to this problem. For me, it still doesn't resolve the governance problems and generally like
what's that?
Totally.
The cultural problems that are blocking us from having data in a data lake or accessible. So it's like, ideally we would take all of our energy and our work and like put it towards like unlocking those issues. And then I certainly do lots of work with data standards. I bet you could leapfrog that if you actually could apply advanced machine learning techniques to the data lakes that we have or that will eventually be connected. Like
agree.
There's like a missing step, which is that people are like, I don't want to share data because it's going to ruin my business model. And
that's right.
Totally.
I think that a lot of times standards are a blocking tool. Like it's like we flush the toilet on the third floor with the light switch around the corner. When in fact it's like you're a bunch of bullshitters. We can do this way better, but like I'm glad that you're enjoying this long process that allows you to say no more. Congratulations.
I feel like you had like a horrifying experience in a government bathroom recently or something.
I mean, things happen sometimes. All right. Nikhil, we got to get rid of you. You're awesome. Thank you for coming on our hangover episode.
Thanks for having me.
All right. Hangover episode.
I don't know, but we're going to switch over to another special guest who we met on the internet. Robert! Oh my goodness. So listen, you guys, many of you know, we do have an actual form you fill out if you want to be a guest.
Yes.
Sometimes we
Yeah.
find you, sometimes
It
you
works.
find us. And I will say, Robert filled out his form the best out of any of y'all. We were just like, who's this guy? This is awesome. So,
Sure.
and also the great thing about him is, Lisa and I often invite people randomly to dinners and things like that. And I was like, hey, I just looked at your LinkedIn profile after I read your form. I see you're in New York City. I'm throwing a party there next Thursday. You in? And he was like, yes. So it worked out, and he's like pretty cool. So Robert, introduce yourself. Like, tell us like what you don't even know what you do. I mean, kind of we know.
Awesome.
We looked it up.
I'm still bubbling over that dinner. It was an awesome experience, but good to see you again. So my name's Rob D'Annabelle. I currently work at an organization called Forge Health. We provide outpatient behavioral treatment services, especially for mental health and substance use disorders. So we're primarily in the Northeast region. We have brick and mortar locations, but also offer virtual services as well. And ever since really joining Forge, have sort of dove deep into the healthcare sector. And when I found out Nikhil was going to be on the show today, I was like fangirling a little bit. I felt like I was like going to like a Jonas Brothers concert.
Oh my God.
Oh my God.
I subscribe to the Out of Pocket newsletter, and so if you don't, I
Y'all
suggest
need better
you do.
heroes. I'm telling you need better heroes. The bar is so low. I can't tell you.
That's what I'm talking about. The bar is low, y'all. We started a talk show. Nikhil's crushing it on the. I don't know. Anyway,
it's going
back
great.
to you.
No, and no, just excited to be here and sort of talk more.
Yeah. Well, so I love, everybody knows my passion project is technology for SUD and OUD. So when you were talking about what you're cooking, I was super into it. So how did you get into that space? So I know you were previously an investor, analyst guy, strategy. I'll make some jokes about that. But yeah, talk to us about how you got into this and and why it matters.
Yeah, no, it's a great question. I actually went to Johns Hopkins for my undergrad. Wanted to become a doctor, and then sort of my junior year, spring semester, was like, I don't know if I can do medical school. I don't know if I'll survive. And so I sort of combined my passion for business and healthcare, and eventually broke into investment banking, covering the healthcare sector. So spent a majority of my career at investment banking firms, working alongside several different types of companies: biotechnology, pharma services, medical device, healthcare services. And after spending some time there, I sort of developed a true passion for the behavioral healthcare space. I've seen it firsthand in my family, as well as loved ones. How it affects the individual, but also the caregivers. And I've also seen how the behavioral healthcare system is broken in so many different ways. So when I was looking for my sort of new opportunity, I wanted to be with an organization that was, front and center, the market leader in the behavioral healthcare category, along with an opportunity to allow me to engage in strategic initiatives. So, that's where I currently oversee corporate strategy right now.
Thanks. Oh, I can.
Yeah.
I can no longer hear you, Kai.
Oh, sorry. No, I was saying Lisa's reading comments. That's what she's doing. Rob, we have a hard time with the LinkedIn. That's Melissa's job. You don't have to do that. Okay.
Sorry.
All right. And you also, in your form, which you filled out so well, you also talked about your passion for equal access, I think, for the LGBT Q plus community. So I want you to talk about that too, because we need to get some more guests who are in that space. So you're the first one to talk about that. So just tell us about that. Like, that sounds like it's your passion project too. So like, tell us things.
Definitely. I mean, as a gay man myself, it's sort of front and center, right? I mean, the fact that, homosexuality wasn't removed from the list of mental
Right.
illnesses since, in 1973. Like, we just
Wow.
celebrated the 50-year anniversary. And
Wow.
so, that's not a long time ago, and so, I'll give a big shout out to the Trevor Project. They are a great organization around
Yeah.
focused on,
Yay.
yes, LGBTQ plus youth. I actually just got accepted to be a volunteer there with the organization. I started
Nice.
training in January.
Nice.
Awesome.
But one of the things that they do is they sort of have a great data set that tracks important information. So, for example, there are still over 1,300 practitioners in the United States that still practice conversion therapy.
Cool. That's great.
Exactly.
Wait, that's
Exactly.
real?
Yes.
Yes.
Say that number again.
Like
What's that number
That was a
again?
lot. That was a really high number.
1,300.
Over
Oh, it's not-
1,300.
Oh my
Jesus
god.
Christ. Gross.
Exactly. And so, I think that there has been such great momentum in this space, especially in the healthcare, health tech space. A lot of great companies out there. But one of the things that you always see, and I feel for, in the BIPOC community, the female community, as well as the LGBTQ plus community, there is always a lack of funding, from
Yeah.
an investing side, but also a lack of
Totally.
funding in the research side, right? And so,
Mm.
you know, it's
Oh, I have a good
something
one on that,
that,
Robert. They just like
yes,
literally just like I want to say yesterday or the day before, like just came out with a like after studying for a number of years, like one woman researcher was like, I'm gonna actually study this, like I'm gonna make it work. Finally figured out the actual like genetic cause of hyperemus gravidarum, which is the
I
really
saw that.
the like the really intense kind of morning sickness where you throw up or you vomit
yeah,
the entire time. And they literally just, it's like basically 2024. They like just figured out, they just finally did research and figured out what it was. And this is like an incredibly serious condition that like destroys people's lives for at least 9 months, if not longer. And just like really, really serious, like never studied, never figured it out. Finally, someone was like, "Hey, maybe maybe it's actually a thing. Maybe it's not just like a random like, oh, that lady should just buck it up and make it through."
Yeah.
So that kind of thing's happening all the time. All the time.
exactly, and I saw that as well, which I mean, it's great, that it's finally
Yeah,
coming to fruition. I mean, my sister,
right.
if you're watching, hi Jess, she's pregnant right now, and I always text her. I'm like, how do you? I mean, I have a headache, and just getting to work sometimes is a pain, and I can't even imagine, the individuals who are pregnant and suffer from this. It's just another reason why we need to be bringing importance and to this to these communities at the forefront of that
Right.
next innovation, right? You asked Nikhil, I think, what are the exciting, bullish moments and bearish moments for next year. And I do see some great momentum behind the female healthcare space, behind the LGBTQ plus healthcare space, but I always think that we could be doing more.
Right.
Which then sort of ties back to my work at Forge Health, right?
Nice.
In 2019, the National Institute of Behavioral Health stated that over 52 million individuals, adults in the U.S., suffer from some form of mental illness. And so it's a huge problem. We're all well aware of it. And so, and then tying it back, LGBTQ plus individuals experience rates of mental illnesses at a 2.5 times rate compared to their heterosexual counterparts. So it's a widespread, sort of epidemic, if you will, across this nation. And I love, connecting with individuals like yourselves and the dinner that, I was able to attend, because you hear all of the wonderful work that's being done, both in the traditional healthcare services space, but also the health tech space to combat, this issue.
So
Yeah, there's also like there's a couple of, I mean, one of the ways one of the like maybe more obvious ways this is being tackled sort of within the traditional healthcare system is, insurers, those who like lean on virtual first care, setting up shop and trying to specifically serve different communities. So I know that Included Health is trying to do this. Folks, there's a couple of those other companies that are trying to serve a specific population, often LGBTQ, but also women. There's different types of clinics like Maven, others that serve specifically other populations. But like I don't know if that goes far enough, because that's, for me, that's just like, that's a little bit surface. Like I'm sure it goes beyond that for people who are actually patients there, or that's their provider or whoever. But like it's we still operate from a healthcare system that prioritizes like finding cures, funding things for a very specific demographic, which is mostly male in a certain age group, usually white men. Like it's a very like, that still is always the baseline. It's always the default. We still suffer as a healthcare system from a default patient, and that's not most people, right? All of us, we're not in that group. None of us here are.
Such an important part, because I think that we're finally coming to this fruition that
Right.
there is an intersection between physical health and behavioral health, right?
Yeah.
And so the fact that when people think of LGBTQ plus health, health, they automatically think of HIV/AIDS. It's the initial thought. It's always the first thing that comes to mind, but that's not the case at all, right? And so what's that additional care and support and resource that we could be giving, is that behavioral health alongside those who may have a partner who is HIV positive, or may have be diagnosed with HIV positive, and supporting them as well as their caregivers, right? I mean, we are all well aware the burden that the unmet need of behavioral health has on the healthcare industry. But you just multiply that effect when you don't offer those behavioral health resources in
Mm.
tandem with our physical health diagnoses. So, for example, one of the things that we're doing, at Forge Health as well, which I believe is so innovative, is that we are building out a psycho-oncology program that provides
Wow.
behavioral health resources for individuals who have been diagnosed with cancer, as well as their caregivers. One of the great people that I've stalked prior to this podcast, and then finally met, was Ben Freeberg.
I love
You know,
him.
he's amazing. Another shout out, Oncology Ventures. He's a great guy, a great organization. But we really connected and spoke about how that if you really identify and help treat those behavioral health issues that are a comorbidity, along with some of these physical ailments, the benefits that you'll see on the entire healthcare ecosystem are just exponential. It's bringing down that
Right.
hospital utilization.
Right.
It's bringing down all of those economic resources that are being poured into for these untreated behavioral health issues, because they've always been seen as secondary. But I think that as
Right.
we more come to the conclusion that this intersection is so important and vital to our overall health, I'm very bullish on our future.
That's
Nice.
awesome. I love it. I love it. It's like Rob for president. Rob for president. Okay, so for you, I want to ask, because we only got a few minutes here, and the LinkedIn does shut us off. So you mentioned lack of investment for LGBTQ plus healthcare, technology, all those things. So bringing investment in. What else are the things that what are the takeaways that our audience should have for how to improve?
Yeah.
This.
Yeah, no, definitely. There have been so many studies on this, which is amazing to see, and it sounds so basic, and that's what I love about Nikhil's podcast again,
Yeah.
is bringing
We're
it down
basic.
back to the basics. Exactly. That just education. Having that access to proper training and education about all of the cultural issues around some of these communities. And it's not only a one-time training; it's an ongoing education, and not just putting up a rainbow flag. It's really understanding the meaning behind that flag, and taking that next step. And so I think just having that foundational knowledge and widespread education is so essential. And I'll give another shout out to Outcare Health. They do a great, amazing job of putting together resources that can help organizations with this.
Awesome. We will
Perfect.
put that in our show comments tomorrow in our recap. That's awesome. All right.
Awesome.
All right. Thank you so much, Rob. Thank you for filling up the
Thank
floor.
you.
You are the example of an amazing person. You're awesome.
Yeah.
Lisa, any last hot takes before we go take a nap? Drink
Go
some
take a
water.
nap.
Take
Drink
some
some
Advil.
water, take a nap. It has been quite a year. We actually have just, I want to say, just one more show this year where we're going to be
Yep.
doing our sort of recap, predictions, all the good stuff. So if you have those and you're listening to this, send them in, fill in that form, send us a message, comment what you think we should cover. But this has been really exciting. I mean, this has been quite a year for us personally and professionally and doing the show. And so that's what I'm thinking about. That's what I'm going to be thinking about in the moment when I go lie down to take my actual nap.
That is
How about
absolutely
you?
correct. So next week is going to be Friday on a Thursday because
That's right.
I'll be traveling for like holidays. I got kids and family and stuff. It is going to be awesome. But yeah, send us any hot takes. Send us some stuff. We got some things going on, and then our 2024 season is going to be amazing. We might
Yeah.
even improve some technical issues. I'm not sure.
We might.
Not sure.
Who knows?
I'm not sure.
Vote for Grace. Vote for Grace for chief.
Vote for Grace. Write your senator.
Chief Patient Officer.
That's
Give her the
right.
vote.
Chief Patient Officer Grace Polanski Cordovano, Chief Patient Officer of HHS. God bless America.
Bye, everyone.
Au revoir.